Say hi.
Hello.
Hello. Okay. So, today I'm going to do a speech on postpartum care. I decided to do postpartum care because in the U.S., pregnancy and childbirth is such a big thing. So much focus is put onto childbirth and not enough on postpartum care. And this is definitely something that needs to be changed in our society, in our country. In other countries, there's more focus put onto postpartum care, and the main reason is to avoid and prevent postpartum depression and any other complications. So today we're going to talk about postpartum care and the importance of it. So, in our society, what happens? A woman gets pregnant, she conceives, she has 9 months of pregnancy, and the whole time she's focused on, what am I going to do for childbirth? What's going to happen? I'm going to get to meet my baby. What do I do? How's delivery going to be? And then, there's all this excitement and anxiousness, but what happens after? What happens after the baby's born? What happens when everybody goes home and the mom is with the baby? A lot of people think it's bliss and joy and beautiful, and it is, but there's another side to it. It's a transition period, and it takes a lot of adjusting and getting used to, and that's what people need to realize, that there is another side to postpartum care. So, this is a quote from Suzanne Arms. It says, "It is a strange culture we live in that focuses so much on the time of childbirth and so little on the crucial time after birth." And that's very true. If you look in our hospital settings, the woman has her baby. They don't see her for another 6 weeks. Well, what happens between delivery and the 6 weeks? Women have postpartum depression. They develop it. They have issues with the baby. The baby might not be feeding well. All these complications that we're not looking into, that we should do a day after home visit. We should do a week visit, and then maybe 2 or 3 weeks, and then 6 weeks. So postpartum care should be just as important as childbirth. So the importance of postpartum care. So there's a lot of important things that come with postpartum care, why it's helpful, what's good about it. It's not just, checking on mother's heart rate, blood pressure. It's a lot of things involved. So the importance is it provides support to the mother, baby, and family. It lowers the chance of postpartum depression, increases breastfeeding outcomes, enhances a mother's confidence. Now, when we're talking about confidence, we're talking about a mother's confidence to be a mother. A lot of times, new mothers, they're not sure if they're doing the right thing, or motherhood, it's a natural process, but it might not always be natural to everybody. So that's something to consider. Enhancing a mother's confidence can determine and really benefit her and have positive outcomes for the mother and baby. And then better outcomes in monitoring of mother and baby. So if we have quality care, postpartum care, we are able to really assess the mother and the baby, monitor them, see if something's off, see if we can fix anything, if the mother's having issues breastfeeding, if there's an infection developing, if there was a hemorrhage and we didn't catch it, if she's bleeding too much. So quality postpartum care can really ensure that mother and baby have the best care provided. Then we have personalized care. So a lot of the times with midwives, we have this personalized quality care. In the hospital setting, they're taught, it's impersonal. Don't get attached to your clients. And then in the midwifery model of care, it's more of you need to get personal. You need to dig deep. You need to have this one-on-one relationship with your clients. So we technically have visits anywhere from an hour to an hour and a half. Whereas, sometimes when mothers go into their regular postpartum appointments at a hospital or a doctor's office, they can wait in the lobby for an hour and be seen for 10 minutes. So Personalized care is the key. And then we have offers emotional support, counseling, healing tools, and acknowledgement. So emotional support and counseling, as in if a mother needs to vent or needs to just somebody to listen to her, it's important to be able, as a care provider, to listen to the mother, give her resources, educate her, tell her, reassure her that some of these things are normal and it's okay to feel like that. Acknowledgement, if a mother had a traumatic birth and she's trying to get over it, but she's masking the issue, she's acting like she's okay, and she had a very traumatic birth, it's very important for the mothers to realize they need to let go. They need to acknowledge and let go. So as care providers, our duty is to let them see those emotions, let them see what they went through, and let them know it's okay, and now we need to let go in order for the healing process to happen. So, and then you can stop recording.